Welcome to today's episode of In the Trenches, a McDermott Health podcast on healthcare enforcement and litigation. I'm your host, Brian Stimson. I'm a partner at McDermott. And before joining the firm this year, I served as acting general counsel and principal deputy general counsel for the U.S. Department of Health and Human Services in Washington, D.C. Joining me today is Julian Andre. Julian is my law partner at McDermott. He began his career at the firm, left to spend 6 years as an assistant U.S. attorney in the Central District of California, and then rejoined the firm in 2021. Julian, thanks for sitting down with me today. It's great to see you.
Thank you for having me, Brian.
So tell us a little bit about your time in the Central District. What kinds of matters did you handle during your service there?
So I was with the U.S. Attorney's Office in the Central District in the Western Division in Los Angeles for 6 years. And I was a member of our major fraud section for almost my entire time there. And as part of the major fraud section, I handled pretty much any type of financial crime you can think of. So healthcare fraud, securities fraud, tax offenses, extortion, money laundering. If it involved money and stealing it or lying and cheating, we dealt with it. And so that was it. I was a frauds prosecutor.
I bet that was both a fascinating study of human nature and a lot of fun being a frauds prosecutor.
It is both. I mean, fraud cases can be very interesting. They can be very challenging. They can be very complex. It's also, a lot of fraud cases are based just on pure greed. And so those are kind of easy to get out of bed and work on.
I've always thought of the Central District as being one of the major national hotbeds of healthcare fraud, along with the Southern District of Miami and certain jurisdictions in the Northeast and maybe the Eastern District of Michigan. Why is that? Why is there so much healthcare fraud in the Central District?
So you're correct. There is a significant amount of healthcare fraud and healthcare fraud cases out of the Central District. I was born and raised in Los Angeles. So I will say I do not feel that somehow those of us that live in Southern California have a natural tendency to engage in fraud. I think that one of the big things is just that the Central District covers such a gigantic area. It's 5 counties. California itself is the 5th biggest economy in the world, I believe. So there's a lot of money, a lot of people, and a lot of opportunity for fraud. And a lot of at least on the criminal side, a lot of the fraud that takes place out here involves kind of taking advantage of sometimes lower income, underserved communities where there is, in fact, a fair amount of a population that could be taken advantage of in cases like this. So I think that's really what it comes down to. But the reason it may seem like there's so much healthcare fraud in the Central District is largely because the Central District is so huge.
Makes perfect sense. What kind of healthcare frauds did you see in your practice? Did it run the gamut, or was there a particular kind that stood out?
I think of Los Angeles and the Central District as being incredibly diverse in every way, including in the types of fraud schemes we see.
Fair enough.
But I think the two most common are the two most common they would be anywhere. So you have basically medical necessity cases where you have marketers, getting, beneficiaries to agree to, the perfect example, like the DME example, marketers going out and getting people to try to get a fake wheelchair that either they never receive or don't need. And then that gets billed to Medicare. So a lot of patient marketer cases, and DME stuff has slowed down significantly. And now a lot of those types of cases are happening via telehealth instead of these in-person clinics, but those same types of medical necessity cases. And then there's still also a fair amount of kind of anti-kickback type cases that you will see in the Central District. And there's been a number of very big kickback cases that were charged out of our district in the past 5 years.
I understand you also had some leadership roles. You were the securities fraud coordinator for the office, and you were also the education fraud coordinator. Can you tell the audience what those roles entailed?
Sure. So both roles were actually kind of different. So as securities fraud coordinator, my responsibility was primarily focused on our office's relationship with the SEC's Los Angeles regional office. And that meant there was a couple of different things that I would typically do. First and foremost was to make sure that the U.S. Attorney's Office and the SEC were coordinating whenever there were parallel criminal and SEC actions. So just make sure we were keeping track of what was going on in the parallel cases. The second kind of aspect would be to work with the FBI to kind of intake any tips that may come from the SEC. So the SEC oftentimes will get tips of potential securities violations or other criminal activity. And so we would, as those tips were coming in, we would try to evaluate them at the front end to see if there was something that needed immediate attention, try to prioritize kind of stuff at an early stage. And then the last aspect was just being a resource for other AUSAs in the office to talk about various issues that could arise when you have parallel SEC and criminal investigations. Education fraud coordinator was slightly different. So what we did was, I want to say it was about maybe 2019, we actually set up an education fraud task force in the Central District with the Los Angeles Unified School District's Office of Inspector General and a number of other federal agencies. And I was the U.S. Attorney's Office's representative as that task force and coordinating the activities of the task force. And that was more of an active role in terms of working with each agency to identify cases, help, kind of incubate new investigations and get them off the ground and get them running and keep them kind of going up until the point where they may need to have a permanent AUSA assigned to take over for search warrants or for charging or for things of that nature. And so that was more of a kind of hands-on coordinator role.
I'm really curious about the education fraud area because I didn't know that was a thing. I work in almost exclusively in healthcare, but what are the issues in those cases? What do they look like?
So most of the education fraud cases that we worked on were involving public charter schools. That was one of the big areas. And those cases, in some respects, kind of will look similar to healthcare cases. And so what you're really dealing with is these organizations, charter schools receiving public funds that's supposed to be used to provide education services to a particular set of students. In order to get those funds, they need to submit applications to the state and to the federal government to make certain representations as to what they'll use the money for, why they're entitled to the money, and what they won't use the money for. And so most of those cases involve some sort of fraud, either in connection with the receipt of the money or how they're going to use the money. And a lot of those cases also just involve misappropriation of funds. So you'll have an executive at a charter school who will, take, $5,000 and, go on a fancy vacation. Well, that's money that's supposed to be going to those students. And so those are a lot of the primary kind of issues you'll see in that context. But you also can see issues where, and there was a state case out of San Diego, A3 charter schools, where the executives recently pled guilty and agreed to pay back $200 million. And what they were doing there was they were inflating enrollment figures and then using those inflated figures to get more money. And so most public funds awarded to schools, charter schools, or even regular straight up public schools are based on what's called average daily attendance. So if you can inflate your numbers, inflate how many students you have attending your schools, you're going to get more money. And that's would be similar to, medical necessity and providing services that were, billing Medicare for a wheelchair that was never provided, or, upcoding a particular service. Similar concept.
It has the flavor of a grants fraud almost.
Yes.
The federal grants fraud. Do you think those cases are we're going to continue to see those? It seems like we would, because charter schools are proliferating and becoming more popular.
You absolutely will. And they've been increasing in frequency over the course of the past, 5 or 6 years. I think when the first charter school case that I charged in the end of 2019 was one of the first big charter school fraud cases charged federally in the country. Since then, there's been a number of additional ones. There was just one charged out of SDNY, I want to say a couple of weeks ago, involving, I believe, a former administration official from the President Obama administration who used about $200,000 of charter school funds to try to get a mortgage for his house. So I think these will keep coming.
I'm laughing because if I didn't laugh, I would cry.
I think these cases are going to continue to come. I mean, one of the benefits of charter schools is it eliminates some of the oversight. So these schools can really kind of do what they have, more flexibility to serve their students and serve their communities. And there's a ton of amazing charter schools who do that. But the downside is there's a little less oversight. And that provides more opportunity for people to take advantage of that at times. But as the amount of charter schools increase, as the amount of funds increase, I think you'll continue to see these cases. I think U.S. Attorney's offices throughout the country are aware that these are potential issues. I know the Department of Education, Office of Inspector General, is aware that there's potential issues here, and they're doing what they can to identify fraud and prosecute it.
Interesting. So you like me, were in government during the pandemic, which was a three-ring circus in many ways, at least for me. How did it affect what you were doing?
Well, so our office shut down. Trials all got suspended. So there was very much just practical impacts in terms of, and particularly in the Central District, they are just now restarting trials in the Central District over a year later. I do not believe there has been a single trial in the Central District since the pandemic began in March of 2020. For most of the time, there's been limited in-person appearances. Our grand juries were shut down on a couple different instances. There's been a lot of virtual court appearances. And that's the one thing with being a criminal prosecutor is with civil cases, a lot of that the judge can just say, we're going to do this virtually. But criminal defendants have to agree to pretty much anything that happens virtually. So it made a lot of things just go to a standstill. We obviously kept working. The cases didn't go away. We got a lot of motions for temporary release due to COVID. A lot of everyone who's ever prosecuted a case has had multiple defendants who were already sentenced claim they should be given compassionate release due to COVID. So there were a lot of practical impacts. The other thing is it did drastically change what we were doing as frauds prosecutors, particularly frauds prosecutors, because as soon as it hit and as soon as the CARES Act passed, we knew and were basically preparing for an onslaught of COVID-related fraud, whether it be the PPP program or other unemployment insurance, healthcare. We knew that was going to be a big deal. We knew that we were going to have a ton of work to do to combat that fraud, and that it would be starting immediately and be considered an emergency. And it was. So by the time I left the U.S. Attorney, I went from having nothing to do with COVID-related fraud because COVID didn't exist to probably spending 60 to 70% of my time working on various COVID-related fraud cases.
Did that have the effect of bottlenecking other investigations that you would do in the ordinary course, or did you never even get to that point because all you were focused on was COVID?
A little bit of both. So priorities always shift. There's always going to be, whenever there's kind of an emergency, there's going to be a focus on that, and some other things may take a back seat. Obviously, some investigative steps we may have planned in other cases, we were going to slow down regardless, because you aren't going to necessarily go send your agents out to interview witnesses in the middle of a pandemic unless you really have to. You're not going to go execute search warrants unless you really have to. If the grand juries are shut down and slowed down, you may wait to indict a case that's not urgent until things are in a little bit more control. So there was some extra time that we weren't using on other cases naturally. A lot of our work is done preparing for trial. We weren't going to trial. So I think the short answer is yes and no. Some things got pushed to the back, some things got delayed, and that became a priority.
So what do you think that bodes for the future? Is there going to be a pent-up wave of enforcement activity? I know people have been kicking around that idea. How much stock do you put in that?
I think there's just going to be an increased amount of enforcement activity. So I think there will be some things that got delayed that will come, that maybe they would, a case that would have been charged 6 months ago, maybe we won't see for another 6 months. But there's also going to be just a continued focus on any fraud related to COVID-19. And anytime you inject over $5 trillion into the economy through government programs, there's going to be a lot of fraud there. There's already been a lot of fraud there. There's already been a lot of cases involving COVID-related fraud. And the Department of Justice has been explicit in saying that it will come after anyone who tried to seek advantage of these relief programs. I forget the exact quote, but I believe one of the acting attorney generals recently said, no matter where you are, we will find you and prosecute you. This will not end anytime soon.
They seem to be doing a good job of it, because I see a new press release on the DOJ website almost every day dealing with some type of COVID relief fraud. So I believe the last numbers were, I know in the PPP loan context, there's been already close to 100 cases, over 125 defendants, hundreds of millions of dollars of losses. And it is not going to slow down. Not anytime soon. I think that's right. That makes a lot of sense to me. So pivoting quickly to just practice in the Central District, I'm curious on your perspective, because I had some cases there prior to government, and it was always a much different process than what I experienced in other federal districts, particularly the Northern District of Georgia, where I practice. It just seemed like a totally different animal in terms of how the court was set up and how it ran. So I don't know if you share that perspective. And if you do, what makes it so unique to practice there?
So, for me, it's completely normal. That's what, and I'd probably go to the Northern District of Georgia and be like, this is so strange. What are they doing? I know I had cases where I had to be in the Southern District of New York, and I would be like, what are these letter motions? Like, these are so strange.
Those are strange.
Okay, so we can at least agree on that. So look, the Central District is unique. Again, it is a gigantic district. It covers 5 counties. We have, the courthouse in Riverside, we have the courthouse in Santa Ana, we have the courthouse in downtown, multiple courthouses in downtown Los Angeles. So that does, and there's a lot of different judges. So I think one thing that makes practice in the Central District unique is that each different district court judge has very much their own preferences. They're very different. It's a very kind of diverse bench in terms of how each judge will approach cases. It is also an aggressive, a lot of them it can be an aggressive bench where they have, incredibly, high standards and can be very particular and demanding. Another thing that I think also makes some of the judges a little bit unique is that the caseload in the central district is extremely large for every district court judge. And from my experience and from the discussions I've had with district judges and others, I think district judges in the central district feel much more overworked than district judges may in other areas of the country and have just a greater caseload. And for example, I mean, I forget how many vacancies there were. I think at one point there were 8 vacancies in the central district when at the end of the President Obama's administration. I think maybe 3 or 4 of them were filled, but there's still a ton of vacancies. The central district went, I want to say, close to 5 years between when it got a new district judge. So you have already a giant caseload, not enough judges to handle it. And so, yeah, the judges are going to be a little bit more particular and potentially, a little more, demanding in terms of their time and what they expect of the attorneys that are appearing before them, because they don't have the time or resources to mess around.
I mean, they could figure out that blue slip process on the Hill. You might have more judges. Always seems to work to California's disadvantage, but that's a totally another issue. Do you have any words of advice for general counsels who might find themselves in investigations or litigation there?
So I think when you end up in front of you need to do your research on the particular judge who you're going to be appearing before, because there are a number of judges that are very particular, and how you would approach a case in one courtroom is not going to be the same as you will approach a case in another courtroom. And we had to deal with that all the time as prosecutors in terms of knowing, you just knew there's certain arguments you don't make before certain judges. There's other instances where you can take maybe a more aggressive approach because the judge is going to be amenable to it, or judges that have just particular things they dislike that you just need to know to avoid. So that's, I think, the first thing is just make sure you know which courtroom you're in, because it's not enough to know, I'm in the central district. You need to understand the judge you're appearing before. And then in terms of dealing with the central district, if there's an investigation, the central district works differently than other districts. And so I think you want someone who has experience dealing with the U.S. Attorney's Office in the Central District of California, dealing with that U.S. Attorney's Office and has relationships there and knows how things operate.
Good advice. So what was your most memorable moment there? Are there any that stand out? I'm sure there are many, but what was the most memorable? So
I spent almost 3 years as a lead prosecutor on Michael Avenatti case, which unfortunately I can't talk about because it's still pending. That was certainly interesting and certainly memorable. My charter school fraud case was also very memorable. It was a challenging investigation. It was a challenging case. It was my last trial, and it was a very hard-fought trial. I think the jury was out for 4 or 5 days, including over Thanksgiving. But for the most part, all my time at the attorney's office was memorable in some way or another. I mean, you work on big cases, you work on small cases. It's there's a special camaraderie that you have with other AUSAs. And then there's, you can develop relationships with even defense attorneys. And in the fraud cases, sometimes some of the most rewarding relationships are, the relationships you develop with, sometimes the victims, in terms of them knowing that, you're fighting for them and trying to get justice for them. And those were all very rewarding experiences.
It sounds like it must have been. That's great. Well, any other additional insights that you'd like to add before we wrap up? It's been a great conversation.
Sure. So a couple things I'd say. First, I think anyone who finds themselves with any interaction with the government, whether it's, they receive a subpoena that's just their custodian of records, or they receive a civil investigative demand or an administrative subpoena from HHS-OIG. I think it's very important to make sure that they get kind of competent, good counsel who's going to handle that stuff appropriately. There's so many times being on the government side just kind of reemphasized for me how big of a difference having just good lawyers to see someone through a process can make. And because anytime you're dealing with the government, whether it's answering a subpoena, submitting a grant application, there's always a certain level of risk there. And having good people to see you through that, it does make the difference. And I know of cases where lawyers came in and were able to really just steer their client away of potential issues from the get-go through just good advocacy and knowing what they're doing. And, ultimately that's hopefully what, I'll be able to do for our clients here at McDermott. And then I think beyond that, I'd tell our clients to make sure that